Hello and welcome to today's webinar. I am Trevor. I'm the Communications Manager for the Canadian Cancer Survivor Network. Thank you everyone for attending today's webinar, which continues our spring leg of 2023. If you're new to our webinar series, a little background on our group. CCSN works to connect patients, survivors, and other stakeholder groups with decision makers and the wider community to engage in discussion and to act on evidence-based best practices to alleviate the medical, emotional, financial, and social costs of cancer. To learn more, visit survivornet.ca. Now, this webinar is being recorded and will be available on YouTube, and a link will be provided by the email that you registered with, along with a link to the slides provided in this presentation. We'll have a quick Q&A session at the end as well. If you'd like, please put in your questions at any time on the GoToWebinar sidebar. And now to introduce our presenter. Unfortunately, Michelle could not make it, so Theresa Blondin has been with the National Volunteer and Program Manager at Bladder Cancer Canada since 2021. Theresa brings over 20 years of involvement in the not-for-profit sector, both as a committed staff member and avid volunteer. Since 2016, Theresa has worked as a volunteer engagement professional, empowering volunteers through their meaningful contributions to support those affected by cancer. And so without further ado, I'd like to turn it over to Theresa for the webinar, Empowering Through Education, Bladder Cancer Canada.
Well, thank you so much, Trevor, and thank you for the warm introduction, and thank you to CCSN for having me here today. As Trevor mentioned, I'm Theresa Blondin, the National Volunteer and Program Manager for Bladder Cancer Canada, and today I'll give you a brief overview of our organization and the resources and programs we have to help the bladder cancer community. So first of all, it is May, so happy Bladder Cancer Awareness Month. Every May, we take time to focus on raising more awareness of bladder cancer in the general public and the medical community. We really want people to recognize the symptoms of bladder cancer so they can catch it early. As we know, early diagnosis can save lives and also save people's bladders. So Bladder Cancer Canada is the first and only national and patient-focused bladder cancer organization. Our mission is to support and educate patients, increase awareness, and fund and promote research. And our hope is that one day, bladder cancer will be just a memory. And this vision would not be possible without the support of our medical community, our generous donors, and our volunteers who run our programs. So how did Bladder Cancer Canada begin? Well, it started in 2009 with two patients, David Gutman and Jack Moon. They saw the need for support for bladder cancer patients and they founded Bladder Cancer Canada. They were inspired by the Bladder Cancer Advocacy Network in the US, known as BCAN, who do similar work as BCC. And you know, how David and Jack started the organization was literally going to the cancer center, handing out cards with their phone numbers and saying, if you need support, call me. I'm here to help. I know how difficult a bladder cancer diagnosis can be. So a lot has happened since 2009. I'll give you some Coles notes. In 2010, we held our very first bladder cancer walk called Canada Walks for Bladder Cancer. In 2011, the first meeting of our medical advisory board was held. In 2012, we launched our See Red, See Your Doctor campaign. In 2014, we helped develop the Canadian Bladder Cancer Information System, known as CBCIS. In 2015, we released our first set of patient guidebooks. In 2016, we established the Bladder Cancer Canada Research Grant. In 2018, we launched an online discussion forum. In 2020, we helped get Padcev, a new drug, approved by Health Canada for bladder cancer treatment. In 2021, we helped get 2 new immunotherapies approved. And in 2023, we were able to hold our first in-person patient meeting since COVID, and we're continuing our growth and our outreach exponentially. So who makes up Bladder Cancer Canada now? Well, we have 6 full-time staff and 2 part-time staff, a national board of directors comprised of 14 volunteers, which includes patients and professionals, and over 400 volunteers who are involved in different capacities. So some are ongoing roles, providing that one-to-one peer support or hosting support groups, or some just simply help one day a year at our annual walk. We need, all our volunteers in any capacity they're willing to help. It all makes such a difference. And we also have a contact list of over 20,000 e-newsletter subscribers who want to stay up to date with BCC news. So that includes our educational webinars, events, and we try to provide anything that the bladder cancer community would be interested in, including new research initiatives and clinical trials, things like that. And we're also honored to have 30 of the top specialists in bladder cancer across the country as part of our medical advisory board. So they help us with research and programs. They review all of the patient materials we put out. They support our activities. They promote Bladder Cancer Canada to the patient community. They develop standards of care, and they help us decide where our funding should go. So why is our mission so critical? Well, over 13,400 patients are diagnosed per year. That's 37 people a day hearing the words, "You have bladder cancer." In addition, 80,000 people are currently living with bladder cancer in Canada, and 75% of those are non-muscle invasive bladder cancer. And bladder cancer also has a 60 to 70% recurrence rate, so it makes it the most expensive expensive cancer to treat. Bladder cancer is the 5th most common cancer, the 4th most common for men, 8th most common for women. But for research funding, it ranks 21st out of the 24th most common cancers. We get no government funding. Everything we do, keeping the lights on, putting out our materials, it all is from donor dollars and our fundraising initiatives. So a little bit of information about bladder cancer. What are the symptoms? The most common symptom is blood in your urine. That's our biggest mission, is to let people know if you see red, see your doctor. It's never normal to have blood in your urine. It does not mean you have bladder cancer, but it definitely means you need to see a doctor and find the reason. Other symptoms are a need to urinate frequently, trouble urinating, pain or burning when urinating, or back, pelvic, or groin pain. So there are different types of bladder cancer. The first being muscle invasive. Approximately 25% of bladder cancers are diagnosed at this stage, which means that cancer tumors have grown through the lining of the bladder into or through the bladder muscle. The most common treatment for this is a radical cystectomy, which is bladder removal. So if you do need to have your bladder removed, you're provided different diversion options after a radical cystectomy. Those options are a neobladder, which is a bladder remade inside your body, or an iliac conduit, or an Indiana pouch, which would include having a ostomy. And then there's non-muscle invasive bladder cancer. So approximately 75% of bladder cancers are diagnosed at the non-muscle invasive stage. And that means that the bladder cancer is contained completely within the bladder and has not penetrated the muscle. And the most common treatment for this is actually an immunotherapy called BCG. And then there's also metastatic bladder cancer. Metastatic is when the cancer has spread from the bladder to other parts of the body, such as lymph nodes, liver, lungs, and bone. It's also called advanced stage for bladder cancer, and approximately 10 to 15% of patients are diagnosed at this stage. So how is bladder cancer diagnosed? Usually it would be a urine test and a cystoscopy. Also scans like CT, MRI, or a PET scan, and all people who receive a bladder cancer diagnosis will go through a TURBT, which is the transurethral resection of a bladder tumor, which is basically a biopsy on the tumor. So we are unsure of the causes of bladder cancer, but some risk factors have been determined. Those include smoking. It's a leading risk factor along with many other cancers, but smokers are about 4 times more likely to get bladder cancer than people who have never smoked. The good news is, though, if you quit today, your risk of developing cancer lowers every day. Increasing age, bladder cancer can occur at any age, but it's rarely found in people younger than 40. Race, there has been research that shows Caucasians are at greater risk of bladder cancer than people of other races. Being a man, so men are more likely to develop bladder cancer than women, although we are seeing more and more women reaching out to the organization who have been diagnosed with this. Exposure to certain chemicals. So chemicals linked to bladder cancer are arsenic and chemicals used in the manufacture of dyes, rubbers, leathers, textiles, and other paint products. And then there's also links between specific previous cancer treatments, certain diabetes medications, having chronic bladder inflammation, or a personal or family history with cancer. So currently there is no way to prevent a recurrence of bladder cancer, but it is important to take steps to stay healthy. So eat plenty of fruits, vegetables, whole grains, and moderate portions of lean meat. If you smoke, please stop. Limit your alcohol consumption, and daily exercise and regular checkups will also support your health, like everyone knows, and they give you peace of mind as well. Okay, so let's now talk about Bladder Cancer Canada and all of our programs and services that make us so unique. So first of all, we offer emotional support in 3 different ways. We have our one-to-one peer support, our discussion forum, and our support groups. So we currently have about 45 volunteers who offer one-to-one peer support over the phone. They don't offer medical advice, but they can speak to a perspective of someone who's been there and can help answer questions to your concerns or inquiries. So a lot of the time this service is used for someone who is getting their bladder removed and they're trying to make a decision between a neobladder and an iliac conduit. So I can set them up with 2 different volunteers, one who has chosen a neobladder and one who has chosen an iliac conduit, and they can kind of hear the real life experience of that decision, you know, pros and cons, lifestyle, that kind of thing. We also have 11 support groups across the country that serve as welcoming and non-judgmental platforms in which bladder cancer patients and caregivers can share their worries, challenges, and questions with others who have been in their shoes. This is a really nice option if you want to talk to a lot of people at once and hear a lot of different opinions. We have support groups for specific things such as women's. We have a women's support group, we have a metastatic bladder support group, and then we also have some related to geography. So like our British Columbia support group or our GTA Ontario support group, things like that. And then our discussion forum, it's available 24/7 and it's open to anyone who would like to register for the service and post questions as well as share their experience. So you can read through the forum without registering, but if you wanted to post any questions on there, you do need to register. And the forum is moderated by experienced bladder cancer survivors. We have 3 volunteers, Alex, Steve, and Karen, who go through that. And patient education is also a large part of our mission. So we offer webinars live and on demand for patients and caregivers, and they're led by researchers, urologists, oncologists, registered nurses, other medical professionals, or anyone else who we think could really benefit our community. We have 6 different patient guidebooks available in English and in French, and the majority have been translated into Hindi, Punjabi, Spanish, and Chinese as well. These guidebooks were written by patients for patients so that it's in terminology that you can understand and from a perspective of someone who's been there. And then, of course, it's proofed by our medical advisory board for accuracy. And we are working on a guidebook right now for healthy living that we hope to release by the end of the year. And we also have materials specifically offered to doctors, including our diagnostic summary tear sheets for newly diagnosed patients, because we know how much information is told to patients in those first few sessions, and it can be very hard to remember. You know, people hear the word cancer, and that could be all that they remember. So these tear sheets really break down what tests you're getting, what you've been diagnosed with, any follow-ups, things like that. On our website, bladdercancercanada.org, it's fully bilingual and it provides access to our guidebooks, our webinars, our video library, our discussion forum, as well as helpful information, including bladder cancer facts and symptoms, treatment methods, and bladder removal procedures, a glossary, links, clinical trial info. We also provide tips on questions to ask your doctor, dealing with the emotions that go along with a diagnosis, maintaining a healthy lifestyle, understanding your test results. And then we also have our BCC help desk, and this is a great way to connect with the Bladder Cancer Canada staff, and we're always there to provide help and guidance when you need it, and ideally connect you with the support that best fits your needs. And all of our programs, guidebooks, webinars, events are offered at no charge to our community, thanks to the generous donors. So a second part of our mission is awareness. It is vital that people know if they see red, see their doctor. And we also want patients to know that Bladder Cancer Canada is here for them every step of the way, and all of our services are free. It was so important to Jack and David, our founders, that people knew about our organization at the time of diagnosis. That's when they need the support the most, and we really want to be there for them. So we do have a group of volunteers who do community outreach and education. We were back up and running with this in 2023 finally, and our volunteers distribute our educational materials in hospitals, urology offices, cancer clinics, and they host awareness tables as well. You may also see our ads on public spaces like transit shelters, bus interiors, print media, doctor's offices, restrooms, subways, billboards, things like that. You'll see this, see your pee shouldn't be red either. That's our big campaign. And you know, it gets a lot of attention, and we always say, if it saves lives, then that's what we're looking for. You know, it really grabs your attention. It's quite an image. So, and you also may have seen our See Red, See Your Doctor campaign on television, as well as our Canada Walks for Bladder Cancer and Holiday campaign. Most of these ad spaces and TV ads have been donated to us, which is so great. And we have a new team working on social media campaigns to engage a younger audience, because we really are noticing more younger and younger people reaching out to our organization for support. And as I mentioned, it is Bladder Cancer Awareness Month. So this month we really work on increasing awareness of bladder cancer to the general public as well as the medical community. You know, we hear a lot of awful stories from our community of people who go see their doctor, especially women, and they're diagnosed with a UTI over and over again, and they're just given antibiotic after antibiotic. And we really want to empower patients to speak up and advocate for themselves and say, you know, if I'm seeing blood in my urine, then I want to do further testing. I don't want to just take antibiotics, especially if it happens more than once. And we're also the voice for bladder cancer patients and their family. We advocate and educate on issues such as access to new and effective treatments. We help ensure the supply of critical drugs. We also want patients to know that they have the right to a second opinion and the referral to a specialist. They just have to ask, and they are entitled to that. We also want earlier diagnosis and earlier diagnostic screening, and we're always advocating for the need for more research funding. So the third aspect of our mission is research. And as mentioned, bladder cancer is the 5th most common cancer in Canada and the most expensive to treat. It's the 21st in research funding among the top 24 cancers. So we fund research projects which pursue the diagnosis, treatment, and elimination of bladder cancer. We've funded $3.1 million to date, which we think is pretty great for our little team. We're also co-funding research projects with the Canadian Urological Association and the Canadian Uro-Oncology Group. We fund 3 grants of up to $200,000 annually, with some new partnerships this year that we're hoping to double that amount. And then we have 2 newer initiatives, CBCIS and CBCRN. So CBCIS is a database that captures management practices and outcomes across the bladder cancer spectrum in Canada, with the goal of improving diagnosis, treatment, and outcomes. So this data is currently being collected at 14 sites, and we already have over 10,000 in the database. So CBCIS led to the need for CBCRN. Basically, we have all of this data what do we do with it? So the Canadian Bladder Cancer Research Network was developed, and the goal is to work together to leverage the common strengths to optimize patient outcomes. So according to the Canadian Cancer Society, the number of new cancer cases in Canada is expected to increase in the coming decade, and bladder cancer is no exception. To date, we have raised $3.1 million for bladder cancer research to improve medical outcomes. But to provide the support to the increasing number of people who will be facing bladder cancer, we need to raise an additional $1 million by the end of the year. As I mentioned, anecdotally, we are seeing more and more young people and women reaching out to Bladder Cancer Canada for help. More research is being done to find the nuances within cancer pathologies as well. So we see the future of research having much more patient input, and we work with a lot of organizations to help make that possible. So as Bladder Cancer Canada looks to the future, we'll continue our mission in hope that one day bladder cancer is just a memory. So how can you help, or how can you get involved? First of all, tell patients about our services. If you know someone facing bladder cancer or even has symptoms of bladder cancer, please let them know we're here for them, and we will help them advocate for themselves to get the test to confirm. We always say it's better to just rule it out than for it to turn muscle invasive. We want people to know about us from the moment of diagnosis when they need the support the most. You can also get involved with Canada Walks for Bladder Cancer, which accounts for 60% of our annual fundraising budget. As I mentioned, everything we do, all the resources we put out are due to the initiatives we fundraise with, and also our donor dollars. And if you want to, you can plan your own fundraising event, basically just anything you think would get people in the door and raising some funds. We do have some suggested events on our website as well, but you really can take the reins in that role and do whatever you'd like. Share our Bladder Cancer Awareness Month post. So on our social media this month, you'll see we're really active during Bladder Cancer Awareness Month, and we have a lot of great posts educating people and raising awareness. So feel free to share one or many of those posts. Volunteer within our organization. We have a robust volunteer program, and we need many volunteers. So that can be helping out as a peer support volunteer if you've experienced bladder cancer or been affected by it. We also have caregivers who use our programs. You can host a support group, and we even have people help with the administration side of the support groups who are not affected by bladder cancer. We have our fundraising events that we always need help with people to join our planning committees, data entry, administration tasks. There's lots to get involved with, and we are a fully virtual organization. So I think what's kind of nice about our volunteer program is you really can do it remotely at a time that works best for you in most cases. And you can also donate or become a monthly donor. As I said, we always need more support to continue to grow our resources and continue to provide our resources free of charge to our community. And that's everything I have for the presentation. So thank you so much for your time and attention, and I'm happy to take any questions you may have.
Excellent. Thank you so much for that presentation. It was fantastic. Now, for those who, I know that you went through the risk factors and the symptoms and whatnot, but because of the prevalence of some surgeries with trying to correct certain just treatments, just bladder treatments in general, whenever there are certain surgeries to correct maybe like blockages or say to deal with something other than the need for antibiotics, is there any risk associated with doing surgeries on the bladder per se?
I don't know the full answer to that. I do know that intermittent catheter use has been linked to having bladder cancer. So I would assume, any constant infection or inflammation of the bladder can be a risk factor.
Excellent. Now you mentioned just smoking and drinking and those things that the common suspects whenever it comes to most cancers. But with more talk about processed foods and especially sugary drinks, how much diet's important, obviously, but how much, and whenever it comes to like the sugar content itself or sugar additives, would you say does that enhance the risk of or not?
I think with all cancers, like you said, sugar absolutely increases the risk because that's you want to keep your health, right? And adding unrefined sugars and to your diet definitely is not the healthiest lifestyle. So trying to minimize those. I mean, everything in moderation, right? And we can't keep it out completely, but just trying to be cognizant of how much that you consume, just like alcohol, just like your exercise, everything in moderation, right? And listening to your body.
Excellent. If anyone has any more questions, you're more than welcome to put them on the questions tab in the GoTo webinar sidebar. And also I was wondering, just you mentioned, of course, a lot of the impact about how, as much as this is a major cancer, the funding around it is not as strong. So what kind of, I guess, a wish list, more of a wish list in some sense, what kind of things other than what you're currently already doing would you want to expand into if you were able to get more funding in that sense?
Yeah, well, I have a very large wish list, but one thing I really want, we really want to put out as an organization, and we have started kind of making the plans for it to be released in Bladder Cancer Awareness Month 2025, is a hematuria pamphlet directed at medical professionals. So basically informing them of the implications of blood in the urine and the suggested steps on how to handle that and to treat it with the importance that we feel it has, right? Again, blood in your urine is never normal, even at microscopic levels. So sometimes people don't know they have blood in their urine until they get that urine test, and then they find out, oh, there is blood in there. Let's dig a little deeper. And you need to get that test. You need to get the cystoscopy. You need to get your scans to really know if it's bladder cancer or not. And unfortunately, you do really have to advocate for that and say, ask for a referral to a urologist or ask your general practitioner to send you for that cystoscopy if you do have symptoms, if you do have blood in your urine and there's not an obvious answer as why you have it.
I guess a follow-up question to that would be for just in general screening, because as you say, even microscopic amounts of blood is something to consider to at least go and see a doctor about it, even though it might not be cancer. So would you say that for regular checkups, just in general, for the general population, just if you're going to your family doctor for routine checkups, should that how much should that be looked into, and what age should that start?
Unfortunately, there is no screening test for bladder cancer at the moment. That is something too that I know the researchers would love to see as well. There is a really great urological group of doctors that really are passionate and they're doing a lot of work, but there really is no screening test. So while blood in your urine is an indication, it's not, it does not mean you have bladder cancer. So I would say a urine test, whenever you get a urine test, I believe your doctor does look for hematuria when they do it. He or she looks for hematuria.
Excellent. Well, that is all the questions that we have. So thank you very much, Theresa, for your presentation. It was very eye-opening, and again, hopefully there'll be more of a light shone on this type of cancer. So thank you very much for giving the time to us today. Thank you very much.
Yeah, thank you so much for having me, Trevor.
And thank you to everyone who attended today. This is in the latest in our series. We have a couple more before we take a break over the summer. And our next one might be happening in 2 weeks. Actually, I do believe it is happening in 2 weeks. So check your email for our e-blast. If you're not seeing your email, our emails in your inbox, just check to see your spam folder because we do use a third-party internet service. But if you're not getting them, always make sure you subscribe to our newsletter by heading on over to our website. This webinar will be posted on our YouTube page where you can view that and all of the webinars we have done all the way back to past 10 years on our YouTube channel or survivornet.ca/webinar. So once again, I'd like to thank Theresa, and I hope that everyone has a fantastic day. Ciao for now.